Hi everyone, so as the title suggests, I'm just here to share with you, a few things that helped me while breastfeeding with my son. He's now actually 7 months old, so I basically share with you, things that kind of helped me till he was about at least 6 months. Well, don't mind the backdrop because you'll hear a few trains from now and then, but anyways. Now I've laid out quite a few things here to the left, or to my right, sorry. So hopefully I'll stay on the straight and narrow and not really ramble too much, but I can't promise anything. But anyway, now I should tell you as well, we have only literally been exclusively breastfeeding till now, in the sense that he doesn't take formula, sorry, nor does he take like even rice in his milk, or even just like a rice cereal that you only add water to. Nah, he's just not fond of, I guess, anything that's milky that's just not breast milk. I don't know. Now there are a few things I probably could have done to kind of help that, not help an easier transition. And I think maybe I've used to pump a lot in the beginning days, but that kind of fell off by the time he was even like 4 or 5 months old. So maybe if I kept a bottle through, even if it was breast milk, just kept a bottle going here and there, then he'd probably be more inclined to accept milk that's not coming from the boob, or something milky that's not from the boob. I don't know, that's just in my head. So maybe that that should have helped. But equally, even though literally he doesn't take a bottle of breast milk, well, he will take it under forced circumstances, like when my husband had him for a few hours and I wasn't around. He was hungry, so he just ate because he just had to eat. Going forward, if I had kept a bottle through my routine, maybe he would have been easier to accept other milky stuff. I don't know. He does love yogurt though, so I don't know. But yeah, that's just that bit on me and exclusively breastfeeding. But anyway, now on to things that kind of helped me as I went along. So of course in the first few weeks, it was painful. You're very new to the whole learning to to let him latch properly and all of that jazz, and of course your breasts are going to be sore. So what really saved me, and I actually picked this up from a lot of YouTubers too, is this cream. Now this is the Lancino HPA Lanolin for sore nipples and cracked skin. This nipple cream really helps. Now I mean I don't know if it's much in my head, to be honest, but I do feel like it kind of caused your nipples to kind of heal before you actually got to the next feed. So I really think this helps. I didn't quite, if you notice, the bottle isn't too, it's not like finished, because I used it, but I didn't have to rely on it too much, which was probably good. Now the other thing I actually did get from the Lancino range was these hot and cold breast therapy pads. Now if you notice, the pack isn't actually open because I actually haven't used this yet, but I'm not gonna ditch this because when I'm actually weaning him off the breast, it may be useful, I don't know. But can I tell you what really helped me? Because I suffered from a lot of engorgement at times, and I think a lot of like letdown issues, because I found that he would come to the boob when he was hungry, he would latch on, but I guess the milk just didn't flow readily enough, so he came back off crying and fussing. And what I realized, which literally saved the day, like every time that I went to feed him, I just went straight to the bathroom and I just literally warmed my breasts all around, and just before I put him on, and that saved the day literally. So I said literally too many times, but don't worry about that. Anyway, so I just use, these are just washcloths. This is just to remind me to tell you guys. So these are just washcloths I use, but you can probably just tap your hand if anything, or just any other cloth you have in the bathroom. And I just kept one handy on a towel rail near my basin sink, so I could always have something to use, and something that I guess was clean or sanitary, because he's feeding. So yeah, that really helped me. Now I remember doing prenatal classes, they advised, if you had any pain, or even if you had things like possible like mastitis or even thrush, etc., they still say to feed through it. No, I was skeptical of that, because you're passing the germs still on, but I'll come on to that in a bit as well. I had like pain or tenderness on the outside. It didn't necessarily look inflamed, but it could be the starting of mastitis, being inflamed, because like I tell you, I had engorgement issues. So I actually just fed through it, and maybe within the day or two it went away. Now I did also still check things with like my GP, my doctor here, so always still check things out, of course, with your doctor, but and make sure, I guess, things don't fester. But literally that saved me, because just feeding through it really, I guess, just relieves, if it's a blocked duct, it relieves the pressure, and really clears things. So don't be, I guess, scared like I was initially, but just feed through it and it will clear, or it cleared in my instance, in my case. But The other thing, sorry, I want to mention as well is the whole thing about feeding through it and being worried about, I guess, passing on, I guess, if you're inflamed or an infection or thrush, etc. Because I was worried about that, but can I tell you, ladies, breast milk is so good, because my son literally has not gotten sick. Not been sick, and I've been sick, so I think it's, or my reasoning, like I said, I'm not an expert, sorry, but my reasoning is because, you know, if I'm fighting it, all my, you know, antibodies will be passed to the baby in my breast milk. So he literally has not caught any cold, or, you know, he has a runny nose now, but he's only he's 7 months, so up until at least he was 6, he didn't have even nothing a runny nose, to be honest. But he has a runny nose, but I just think that's sinus. But anyway, I digress. Still feeding through any infection or any, you know, possible signs of any infection or anything is still helpful, because you're also passing your antibodies as well to your baby to help them fight it, because, you know, they've probably already caught it, to be honest, I guess. So I guess don't be too worried. Of course, go to your GP and get it treated if it, you know, because it will, I guess, fester and, you know, and probably, you know, get to something really big. So don't sit on it, but I would advise still to feed through. No. The other thing is I actually didn't suffer from, I guess, any bleeding, so while feeding. I did probably have cracked nipples, etc., but like I said, the Nipple Cream was all I used, just to touch on that before I forget. But no, I'll share with you now, I guess, a few things that helped me, or what I used for, like, breast pads and the brands. I would tell you what I really like, and that's the Nipple pads. These breast pads by Lancino. They have the sticky tape, which you may can see through the wrapper. So they come with this sticky tape, which, you know, really works, and I really like these. But these are quite pricey. I think they're like £5 just for like 60. But then I happened upon another brand which I actually liked, and I think this was at a baby show or something. I don't remember. Yes, a baby show. But anyway, it's by Vital Baby, which you can't see. I have the box here to show you as well. It's by Vital Baby. Now, the only thing I don't like about these is the fact that the glue, the sticky glue on the back, that, you know, after you, the adhesive, after you've been, you know, popping out here and there, it kind of bunches up, or, you know, if the pad shifts around in your brassiere, it kind of rolls up. So the glue, I've you know, looked down and I find that you find a little ball of glue somewhere or something, which is not that pleasant. But literally, it's clear still, I guess, so it doesn't look too bad. But that's the only thing, just be mindful that that may happen or ball up on you, I don't know. But I really like these. And the other one I tried are these washable breast pads. You know, these are by Carrywell is the brand, silk breast pads. These are really nice. You should try them, I think. And I guess they're more, you know, environmentally safe. But I should tell you, they're not the most discreet under your bra. So they will show depending, you know, on what top or, I guess, brassiere you're using. They're not as thin and nice as the others, but it still is fairly thin. If you can see, it's quite thin, and it has a silk side that you put towards your nipple, and then the other layer here that's, you know, on the outside. But I actually like these. This pack, I think, was at least a pack of 3, and literally you probably only need a pack of 3, because I've only gotten a pack of 3, and you can just keep using them, and as I finish, you just wash them and put them down, and then you have them for the next time. But I had started out with the disposables, and I actually like these too, and I still have a few. No, I'll just add this just because. And this is the box that the Vital, the baby one, comes in, so you can actually see this brand, because I don't think I did it justice in my description. Sorry about the noise, guys, but anyway. So, but guess what? I still keep the boxes, as you see, because this is a toy for myself. Anyway, I just thought I'd tell you. So don't throw them away if you got them, because they're really nice, good toys. Anyway, I'll move on to what I use, I guess, on my breasts. No, I should tell you, when I first found out I was pregnant, it was already, you know, a few weeks in, but I had already started to get stretch marks on my boobs, because I guess they were swelling. So if you've seen my Prevent Stretch Marks video, please check that out as well. So I actually just use olive oil on my boobs still, even now, because I'm still breastfeeding, to hopefully keep them intact, I guess. So I don't know if it will help me, because, you know, I haven't finished the breastfeeding to see how they, you know, what state they will rest in, basically. So I don't know, but olive oil on my boobs to massage. You'll see it worked well on my skin in general as well, sorry, if you watch my stretch marks video. But yeah, olive oil on my boobs to keep them, I guess, moisturized. Alright, so now I'll just share with you, I guess, the kind of breastfeeding options in public that I used. So I didn't, where is it? Oh, I didn't opt for, I guess, the traditional apron with, you know, the ones that have a nice boning that kind of cocks off your chest so you can see clearly, etc. I actually didn't opt for them because I had just been chugging along using just my muslin cloth, these smaller squares, which, you know, which worked wonders, or which I really like are these long swaddle blankets, muslin swaddle blankets. This one is by Aiden and Ane. So the really large one, because I just use this for everything. It's like a blanket when I need, or wipe up anything if I need to, or use it to breastfeed, or, you know, etc. But I will share with you why me and breastfeeding in public with covers aren't as successful, because I don't know if it's because I just didn't start early enough covering him up, because, you know, I was home most of the time, but he's just my son's temperament. He just didn't like things covering his face, so he will play with it. So when I do like lay this over my shoulder like this, he will play with this end, and at least I've kept, you know, up here kind of discreet, and, you know, his head is here anyway, so it does still help or keep me a bit discreet. But he tends to just do things all over the place, and even when I try and cover him totally so that he just sees me and him, etc., he just gets flustered. Like, he never even like putting a shirt over his face. It's as if he's maybe claustrophobic, I think. So I don't know, but these, you know, did the trick for me, or are working well still. And I'll move on then to my, like, what I use for breastfeeding, because that also helps with the garments, sorry, for breastfeeding, because that helps me when I'm in public. Now, I love, if you've seen my favorites video, so do watch that too. Anyway, I love using just tanks on the tops. So just a typical tank top under like a knitted top or something, because it was winter when he was born, or even now maybe just a nice loose flowy, you know, relatively thin cotton top kind of thing. I don't mind, because it's getting a bit warm. So tanks on the top, and that helps me of course with feeding in public, because it keeps things a bit discreet, because, you know, when you lift up your top, your covering top, and then to pull down your tank, you know, that top kind of gives you some coverage as well, and then you can get yourself sorted. So that's what I really like. But I'll tell you what I did, just because it may help somebody. I had gone first and bought just breastfeeding tanks. No, yeah, I went and I bought these just breastfeeding tanks, thinking, you know, your first time mom, you know, breastfeeding tanks, oh, I'll buy some, I don't know. So I bought one. These are the first type I bought, but if you can tell, they don't actually have any bras in. I got these from Mothercare, or the brand says here Blooming Marvelous, but I got it from Mothercare. So they don't actually come with a built-in bra, which I learned later on that, sucks really, because you'll have to wear this plus a bra plus your top, etc. And so then I tried one of these. Now, these are my favorite. Now, I also got some from H&M, and I think this one is, yeah, from Gap. So I tried these tops, which have the built-in bra. So they're nursing tanks, so they have the where is it, the popper for when you're breastfeeding kind of thing. It's stuck, but you get the idea. Yeah, so they have the popper. So I tried these, and I really like this, because I just wear them with my breast pads and then I still have on my, you know, my knitted top or whatever over it, and it really just, I feel just comfortable, free, and yeah, just comfortable, I guess. But anyway, so that's a tip. So try the ones, I guess, with the built-in bra if you must. But literally, can I tell you though, like I said, I only have a few of those, because you really only need an ordinary tank, as long as you get one that still gives you some room. So I had some of these skinny strapped ones that are stretchy, so they gave way whenever I needed to pull down to breastfeed. So that's another thing. But of course you still have to wear a bra with them, I guess, so I don't know. But, you know, just in case. Now, I will share, don't judge me if I'm sure, because I'm showing you my underwear, but I will share with you something on the bras, because I think this is helpful, because I went and I bought brassieres or nursing bras. No, yes, I'm not knocking them, because there's some that worked well, but there's some just I will share with you that I would stay, I guess, far from if I could, or if I knew. Now, I'll show you first. Okay, just this. I got some bras from this range. I think it's called Emma Maternity. I got these off ASOS online. Sorry guys, so my battery died, but anyways, so yeah, so these I got from ASOS, the Emma range, and the thing I don't like about these is the fact that they don't retain the tightness. So after, I guess, a few, you know, feedings, it just loose on you. And the other thing is, it's just quite a lot of fabric. Now maybe I guess got the wrong size, I don't know, but I got what I thought would fit me, and I got a size up to kind of thing. and it's still big, so it's just a lot of fabric, so I find it uncomfortable, or I don't prefer wearing these on the clothing either, because you will see a big, you know, it comes all the way up here, a lot of cloth. So I don't know, that's just my take. So there are two sides to this. I don't like these because they are too much fabric, but equally I actually don't like these either because I guess there's too little fabric. Now these I got from H&M and they're comfortable, so I guess these are nice for in the house, etc. But you still have to be careful in the house, but especially not at night. So let me show you, sorry. Just stay away from, I guess, bras. These are nursing bras too, sorry, from H&M. So you have the poppers right here, so you can see. I guess I would just steer clear from the ones that are too low cut. I mean, it may be useful on a few garments. I maybe have one, I don't know, but you can pop out basically. I don't know. And actually these are my size, like, or size up kind of thing. Like I wasn't going for things that are small, so I don't know. But yeah, equally as well to like sleeping at nights, just a no-no, because by the time you toss and you turn, you best believe everything will be on show, almost, so to speak. So yeah, I will too little fabric, too much fabric. Now what I really liked, I guess, are these. Now this is just like a typical bra, so these are kind of less, I guess, in the middle, ordinary, like, you know, padded bra with wires. This actually came with wires on the side, but I just took them up because they were just, I guess, doing my head in. But anyway, so these just worked well for me. These are also H&M, so if that matters. And I shall tell you though, my favoritist, if that's the word, anyway, is a bra from H&M. It's a sports bra, just a typical regular old sports bra. This is one of the newer ones I got recently because I've been like trudging my others like day in day out. But I'll just show you. It's just these. It's actually a low, I think it's called low support sports bra on H&M website. But these, I tell you, when I say comfortable, they're comfortable. This is comfort in a bra, and because they're stretchy, they give enough for you to pop down and feed. Literally not restricted, not, you know, not uncomfortable, not squeezing. Love them. So, and actually I noticed, I think the ones I have don't actually have these poppers, but this one, because this is a new one I got recently, has some inserts, but you can take them out as well. But this will help to, I guess, if you're just making sure your nipple pads don't show or something, I guess, I don't know, come to think of it. But I just love these H&M low support bra, I think it's called. I will talk about, which, like I said, this one doesn't have a product to show you, but it's biting. So yes, he started to bite, I guess a few months in, I can't recall. No, at least when he was about 5 or 6 months maybe. But I literally just was stern with him. I would, you know, he bit me, of course he can't help but just shriek. Sorry, that was my drama impression, forget that. But anyway, he can't help but just shriek, so you would have to just pull away. But equally I just kind of locked up back, or in Jamaica we say lock up shop, and he kind of just, you know, you take it away, you say no, that's not right, that's not the way you do it, kind of thing. And he would look at me like thingy, and then I kind of let him kind of sit through a bit, like, you know, no, you're not getting it, hopefully to get the message through. And I maybe had to do that literally only about 2 or 3 times, and he doesn't bite me anymore. He will, I tell you, he will basically test me, so he will look at me. This is when I know he's not feeding and he's probably just wants to be close to me. He'll look up and he'll be slowly putting the pressure on my nipples, kind of thing, and then he would, you know, he's like watching me, and then, you know, if it gets, when it comes down to hurting and I'm like ooh, he stops, he releases, and then he may try it again. He did that, I remember, at least once or twice at the very beginning stages when I was trying to be like no biting, no. I guess he was just trying to test out how much pressure he can put on. So he did that 1 or 2 times, and then, you know, after that, you know, he just doesn't bite me really. There may be the odd occasion where I think he's actually upset with me or something, I don't know. They really have their own personalities. But anyway, I won't ramble actually, because I'll probably go on and talk about it anyway. But yeah, so biting, just be stern. If anything, you know, remove the breast, you know, close it back up and everything, so that they kind of appreciate, you know, biting is not accepted, it's not, you know, something you want them to do. And then, you know, they do get the, you know, they do get the picture, I guess, eventually. So be persistent, and that really helps, because he doesn't bite me now. But he doesn't have any teeth either, so I don't know if things would be different when he has some teeth, I don't know. But anyway, so anyway, I hope this was useful. Now I have quite a few other things still on the bed, so I will be doing a part 2 to this video. where I guess I just talk about my breastfeeding accessories, which are things like, you know, what I used to pump, how I stored my milk, things like that, you know. Yeah, how I travel and breastfeeding, like what kind of accessories I guess I carried. So yeah, hopefully you did enjoy this video and that it was useful. So I guess do, you know, rate, comment and subscribe, and thanks for watching, and watch the other video too. Anyway, thanks everyone, bye for now. So actually I forgot two things. One is these Nipple Guards. This brand here is Tommy TP. So I tried this, but it wasn't something that I guess, you know, I kind of liked or was very useful or I saw much difference or help from. I got much help from, sorry. Because like I said, I just used the Lantern Nipple Cream really. So I don't know, it's something you can try, but it wasn't something that, you know, I relied on basically. But I also forgot to share with you, I guess, my boppy pillow. And I will share with you, I guess, my feeding positions that really helped me. So boppy pillow was useful. No, I mean, I think this is something good to have because it's multi-purpose anyway. So even if you aren't, it doesn't help you much with breastfeeding, it will help you with, you know, when your baby's playing on the floor or sitting up, you can always use this for a good support. That's what I really like this for actually. But anyway, but it was useful, you know, to stick it just under your shoulder here, and you could rest in here because my son fed for hours, especially at the beginning of his time, because, you know, he was just, I guess he was learning to swallow well or to suck hard enough and etc, and he was developing his jaw muscles, I don't know, but he fed for literally like hour, at least an hour sometimes. But yeah, it got better of course because now he's very efficient. But anyway, so yeah, this pillow was very nice to have, but the feeding position I really loved, which may be helpful to some, is just literally lying on my side on a bed, and then he lies facing me, and you know, you just prop him to your boob, and literally I could even fall asleep like that. But of course, you know, you have to be careful in the early days because they're babies. But anyway, that position was literally, even to this day I use that because, you know, it's just comfortable, especially when you're tired in the early days. So, you know, you just really need to feel like you're resting even though you're feeding. That was helpful. Of course, I guess do try, you know, sit them up once they're finished to burp them, because, you know, I mean, they are being breastfed, so they may not need to be winded as much, but they do need to be winded. So just try and do that. But equally, he sometimes just fell asleep, and when I was tired, to be honest, it just didn't bother to wake a sleeping baby. So, but you know, of course, I guess when they wake up, probably try burping them. Maybe that still will help. So I don't know, but feeding lying down on the side is my most preferred, I guess, method of feeding. But yeah, anyway guys, bye again and thanks for watching.